Hi, Dr. Moji. Good afternoon. Can you hear me, please?
Yes, I can. Good afternoon.
Okay, please, can you? Okay, I can see your video. Awesome. You guys, are we good with the light? I think it's clear enough.
I see a light inside of you. So let it shine. It's time to spread your wings and fly. Reach for the sky. Get up, don't let nothing hold you. Get up right now, right now. Get up, don't let nobody tell you that you can't. There is greatness inside of you. You're the one that the world is waiting for. Every step you take, we go again. 'Cause we believe in you. Say one day you go make a one day, one day, one day. One day you go make a one day, one day, one day. Don't let nothing push you down. Stand with the bow. Yes, we believe in you. Yeah. Don't you give up on yourself till the world knows who you are. Keep on shining. Get up, don't let nothing hold you. Get up right now, right now. Get up, don't let nobody tell you that you can't. There is greatness inside of you. You're the one that the world is waiting for. Every step you take, we go there, 'cause we believe in you. Say one day you go make a one day, one day, one day. One day you go make a one day, one day, one day. One day you go make a one day you'll be like the sun. Say one day you go shine.
Access, more than banking.
It is such a great time to be a member of the W community because we are on a mission to impact the lives of thousands of women health-wise. Get ready for an experience like no other this October as W presents our Health Month. In this year's edition, W will be featuring a health webinar, physical health sessions in branches, cervical cancer screenings, pap smear, free breast examinations, free hepatitis B screening for you if you decide to take advantage of the opportunity. Healthpedia magazine to enlighten you on more information about your health and so much more as the month unfolds. Your W debit card is an advantage for you this season. Enjoy our discounted offerings when you transact with your W debit card. Click the link in our bio now to enjoy all our offers this health month. Ladies, this is not the time to take the back seat. You need a healthy body to achieve all of your dreams. My name is Ifeolua. This is W, inspiring, connecting, empowering.
It's such a great time to be alive and a great time to be a woman. We are live here at Eco Hotels and Suites to celebrate Access Bank's International Women's Day 2023.
Equality is desirable. We've gone through recognizing women and then women are equal. Now equity, and equity cuts across every area of life.
I mean, we're here to stay, they have to accept us, and then we also have to keep proving ourselves.
And if we do more for women, we will enhance the progress, not just of the bank, but of the society.
Because if you're always in dissonance with one another, if you don't cooperate with one another, if you don't value one another, that shows weakness.
Just being an idea.
You are a man, the woman is equal to you.
For the men that were here today to support the conference, I say thank you. And really, you are the real MVPs.
I'm tired of trying. I need help. I want to try IVF. I know it's expensive.
you struggling with a health challenge? Do you need financial help to access treatment? If yes,
apply now for MHSS, the Maternal Health Service Support, a discounted loan by the W Initiative of Access Bank with low interest rates, no loan fees, flexible repayment plan. This is your best bet for financing your health needs. For more information, visit our website on www.thewcommunity.com or any Access Bank branch nationwide. You can also send an email to wcares@accessbankplc.com. Terms and conditions apply. The MHSS has successfully financed hundreds of health procedures.
the next one could be yours.
I see a light inside of you, so let it shine. It's time to spread your wings and fly. Reach for the sky. Get up, don't let nothing hold you. Get up right now, right now. Get up, don't let nobody tell you that you can't. There is greatness inside of you. You're the one that the world is waiting for. Every step you take, we go again. 'Cause we believe in you. Say one day you go make a you down, stand with the ground. Yes, we believe in you. Yeah. Don't you give up on yourself till the world knows who you are. Keep on shining. Get up, don't let nothing hold you. Get up right now, right now. Get up, don't let nobody tell you that you can't. There is greatness inside of you. You're the one that the world is waiting for. Every step you take, we go there, 'cause we believe in you. Say one day you go make a one day, one day, one day. One day you'll be like the sun. Say one day you go shine.
Access, more than banking.
It is such a great time to be a member of the W community because we are on a mission to impact the lives of thousands of women health-wise. Get ready for an experience like no other this October as W presents our Health Month. In this year's edition, W will be featuring a health webinar, physical health sessions in branches, cervical cancer screenings, pap smear, free breast examinations, free hepatitis B screening for you if you decide to take advantage of the opportunity. Healthpedia magazine to enlighten you on more information about your health and so much more as the month unfolds. Your W debit card is an advantage for you this season. Enjoy our discounted offerings when you transact with your W debit card. Click the link in our bio now to enjoy all our offers this health month. Ladies, this is not the time to take the back seat. You need a healthy body to achieve all of your dreams. My name is Ifeolua. This is W, inspiring, connecting, empowering.
It's such a great time to be alive and a great time to be a woman. We are live here at Eco Hotels and Suites to celebrate Access Bank's International Women's Day 2023. equality is desirable.
We've gone through recognizing women and then women are equal. Now equity, and equity cuts across every area of life.
I mean, we're here to stay, they have to accept us, and then we also have to keep proving ourselves.
And if we do more for women, we will enhance the progress, not just of the bank, but of the society.
Because if you're always in dissonance with one another, if you don't cooperate with one another, if you don't value one another, that shows weakness.
I believe is embracing equity. It becomes, so when you embrace something, you own it, you take it as you put it close to you, beyond it just being an idea.
As much as you are a man, the woman is equal to you.
For the men that were here today to support the conference, I say thank you. And really, you are the real MVPs.
Good morning, good afternoon, and good evening to you, depending on where you're joining us from. And welcome to this year's W Health webinar brought to you by the W Initiative of Access Bank. It's a beautiful Thursday evening here in Abuja, Nigeria. My name is Joy Otto, and I'm delighted to be your host at this webinar. I'd also like to meet you, so please go ahead to introduce yourself in the chat box. Tell us your name, where you're joining us from, as it will interest you to know that in previous webinars, we have recorded participants join us from over 5 continents. And of course, today will not be an exception. So please go ahead and begin to introduce yourself in the chat box because I would like to meet you. Taking us further, I'd like to speak briefly on the health months. I mean, a lot of us have been hearing about the W Health Month by the W Initiative. Actually, the W Health Month takes place every October. Now, what we do is that we shed light on vital aspects of women's health, driving conversations that touch upon both physical and mental well-being. And I believe we have people here on the call who have benefited from many of our health programs over the years. So this year, for this year's webinar, our focus is polycystic ovary syndrome, that's PCOS, menopause, and sexual wellness. Now, you would agree with me that PCOS is a common hormonal condition affecting an estimated 8 to 13% women of reproductive age and a leading cause of infertility. While menopause, on the other hand, is said to mark the end of the reproductive years in women. But how much do we really know about this topic? I guess that's why we're here, you and I, to learn. So I would implore you to sit back, take out your writing pads and pen, as there will be a lot to talk about, a lot to learn. That being said, I'm very, very excited about what the session has in store for us today. Now, to take us further by giving us the welcome address, please make welcome with your virtual claps in the chat box, the unit head, Women Banking Team, Bingpe Kisori. Good evening, Bingpe, and thank you for joining us.
Good evening, everyone. Good evening, Joy. Thank you. It's great to be here. Welcome again to the Health Month of 2023. It's exciting. I'm excited. And this topic today is very dear to my heart. You know, there's some things that are inevitable to a woman. Menopause is. And research has shown us that women are going into menopause at a very early age, no more in their 60s or 50s. So we all need to know this. It is inevitable. Just as death is, menopause to a woman, it is inevitable. So if I were you, take your notepad, take your pen, get a glass of water or juice, feel free, relax, and listen. We have brought to you 2 phenomenal speakers that will digest not only your PCOS and also your cells wellness. We need to know what we are doing and we need to know it right. The education is never lost. Knowledge is never enough. So we need to soak in everything they're going to teach us today. So relax, feel free, and enjoy the session. Thank you. Over to you, Joy.
Thank you so much, Bingpe. As you have heard her, you need to relax and be ready for the juicy conversations that we're going to have today, which will be beneficial to our health. I had mentioned that this webinar is brought to you by the W Initiative of Access Bank. So my next speaker will take us on the W Initiative and what we have in store for you. And I know that we want to know, in fact, Mr. I want to know what we have in store. So please make welcome the segment manager at W, Oluwadamilola Osoyemi. Good evening, Dami. Are you on the call with us, please?
Good evening, Joy. How are you doing today?
I'm fine, thank you. Are you ready for us?
Yes, I am. So give me a minute.
All
Let me
right.
put up my slide. Yeah, Jesus, why is still showing? So good evening, everyone. Please confirm that you can see my slide.
Yes, I can see your slide.
Okay. So good evening again. My name is Dami, and I'll be taking us through what we do at the W Initiative. In 2006, Access Bank introduced the Gender Empowerment Program for Women in Business, which was an on-lending and advisory service, or it provided an on-lending and advisory service to women in business, and over $50 million was invested into this program. Upon the success of this program, we saw that women were very valuable to the investing, and hence W Initiative was officially launched. And W Initiative set to meet financial and lifestyle needs of women with our various bespoke value propositions. At W Initiative, we pride ourselves to be the home of everything Access Bank has to offer women. And we say that we are the bank of choice for women in Africa. Currently, we are in 10 African countries that Access Bank has a subsidiary in. And we aim to inspire, to connect, and empower women. At W is not just a one-size-fits-all. We intend to have different propositions to serve women regardless of where they are. So if you're a woman in business, you're a young professional, you're a woman in family, that's W and family, a millennial and Gen Z, or W quintessential, W has something for you. We have something to meet your need. And so briefly, I'll be taking us through the various products that we have for women. The first one is the maternal health service support. At Access Bank here, we call it our baby making product. And this product is a discounted financing solution that is set to cover the payments for medical procedures, whether it's local or international. And so Access Bank has partnered with over 45 leading fertility clinics to give women access to quality reproductive health care. And this product is available to both salary earners and business owners, as long as they meet the lending criteria of the bank. Who can apply for this loan product? A woman can apply, a man can apply on behalf of his wife, or a brother on behalf of his sister, or a third-party sponsor. Now, MHSS can be used for different health needs. First one can be for fertility treatment, child delivery, local or international, for fibroid treatment, bariatric treatment, and other specialized procedures like optical, dental, or for orthopedic surgeries. You can access up to 4 million naira under the MHSS product at an interest rate of 14% per annum, and you can repay this loan over 24 months. Another product we have is the W Power for business women. With this loan, you can access up to 100 million naira. The interest rate is also discounted for as low as 18% per annum, and this loan can be used for working capital, to acquire assets, or for business expansion. The repayment method is also very flexible. We also have the W Power Vehicle Loan, and the W Power Vehicle Loan is to provide access to vehicles for business people to ease their day-to-day operations. And you can access brand new vehicles, pre-owned vehicles, vans, buses, anything, just to ensure that, you know, moving around for your business is very easy. And because this is the health month, like Joy said, October is Access Bank Health Month, we have different screenings available to you as a woman. You can get free cervical screening, hepatitis B screening, and eye screening. All you need to do is just to follow us on the W community on our Instagram, Facebook, and X to apply for this health screening. Also, in this month of October, we have our W Health Month session in branches, and registrations are still open for physical health sessions that will be happening in Delta, Abuja, Benue, and Kwara. You can come with a friend to enjoy this program with the free screenings that will be available in the locations I mentioned earlier. With a W card, you can get special discounts on breast scan, HPV screening, and abdominopelvic scan. Now, I've mentioned financial services that we offer at W Initiative. So I'll just run us through the non-financial offerings that we have available for women. The first one is the Women Prenup Pitchathon and the mini MBA program. This is currently ongoing, and it is available, or it is for women in business, and it is set to help them to, get better in their businesses, to provide them with personal financial management skills, understanding customers, providing good customer service to their customers. We also have our W events in branches, trade fairs, a monthly W webinar series, networking seminars, and the Ladies Let's Drive program. So to get more information on all that we do at W, you have to stay connected with us. So follow us on our Instagram, on our Facebook, and our X handles. And you can also subscribe to our YouTube channel at the W Initiative. So click on the bell button there so that you can get notifications when we upload new stories for you. So for complaints or inquiries about what we do at W, you can send us an email on wcares@accessbankplc.com. Thank you. So over to you, Joy.
Thank you so much, Dami, for that presentation. What more can you expect from your financial institution? Please tell me now. I hope every woman dialed in today takes advantage of what the W Initiative is doing for women across the world. And if you're a man on this call, you can also spread the information to every woman around you. Just like Dami rightly mentioned, follow us at the W Community on Instagram, Facebook, and X, formerly called Twitter. The links are being dropped in the chat box, so you can click on the link, which takes you directly to these pages, so you can sign up and take advantage of the several offerings still going on in the month of October. I can also see people that are still introducing themselves in the chat box. If you're just joining us, welcome. Keep introducing yourself, tell us your name, where you're joining us from, and you can also make friends in the chat box. Now, this webinar aims to provide comprehensive education to women and families on how these conditions, that's PCOS, sexual wellness, and menopause, affects the overall well-being of women, as well as highlights methods for effective management. Now, we have two great speakers on the call today, professional speakers, if I must say, in their respective field, who will discuss this topic with us today. I have Dr. Mojisola Aderomu. She's a medical director, Medical Arts Center. I also have Fambuki Ayoade. She's going to speak about menopause. She's a menopause lead, NHS England, and the CEO of Vibrant Midlife Wellness Practice. Now, without further ado, I will just read their profiles briefly, and they would come on board and speak to us about this topic. Now, I'll start with the profile of Dr. Mojisola Aderomu. Dr. Mojisola graduated from the University of Lagos in 2008, where she obtained her MBBS degree. She went on to serve in the National Youth Service as a medical officer at the General Hospital, Mubi, Adamawa State. Her passion for women's health was further cemented during this 1 year and led to her postgraduate residency training in obstetric and gynecology at the Lagos University Teaching Hospital, Idi-Araba, which she concluded in 2018. She obtained her fellowship awards in obstetric and gynecology from both the West African College of Surgeons and the National Postgraduate Medical College of Nigeria. She has publications in reputable local and international journals and has attended several international conferences, including poster presentation at the 2016 RCOG conference in Birmingham, United Kingdom, as well as at the 2022 IFFS virtual conference in Athens, Greece. She's also a member of the Nigerian Medical Association and Society of Obstetrics and Gynecology. She passionately supports causes for the well-being of women and girls. She spends her free time engaged in advocacy and volunteer work for a couple of non-governmental organizations, that's Girls Aid, and Beyond the Classroom. She has also held several leadership positions over the years and presently is the medical director at the Medical Arts Center, Ikeja. Are you here, Dr. Mojisola? Please say hi.
Hello.
Okay, thank you very much. I'll quickly read the profile of Fambuki Ayode. Buki is a menopause specialist and a certified health and wellness coach to midlife women. Her wellness coaching is underpinned by 35 plus years of experience and a pharmacist working within medical affairs of various blue chip pharmaceutical companies. She's the principal consultant at Vibrant Midlife Wellness Practice. Buki also leads a work stream on the NHS National Menopause Program. Her team has been responsible for the launch of the National Menopause Guidance of NHS staff and a menopause e-learning model at NHF England to support the 1.3 million strong NHS workforce. Wow, amazing. With her coaching, she has helped motivate women in midlife navigate hormones chaos to get fitter, healthier, and more confident by supporting them to create their own personalized menopause care plan. Buki also helps organizations support and retain highly skilled midlife women through menopause awareness, training, coaching, and consultancy. They're an asset. Her other passions are image and style, F1 racing, travel, and good food, mainly Mediterranean and Nigerian cuisines. She lives in the South Box, UK and Lagos, Nigeria, and is a mother to two young adults, 31 and 27. Wow. Please, Dr. Fambuki, please, can you say hi to our audience? Fambuki, are you here with us?
Yes, good evening. Hi,
Good
I'm
evening.
here.
Good
Thank
evening. Okay, so I would quickly like to mention that in the course of this webinar, if you have questions, don't hesitate to drop the questions in the chat box. Please don't hesitate to drop your questions in the chat box. Now we're going to get right into it. I would like to call our first speaker for the day. Now, with your virtual round of applause, just like we do it, I want to see your claps in the chat box. Please make welcome Dr. Mojisola Adiramu for her presentation. Welcome, and thank you for joining us today.
Thank you very much for having me. I have to start by extending my deep appreciation to the W team, especially to Oyin Damola, who has followed up tenaciously. Thank you so much for having me once again. It's always a pleasure to share my time and knowledge with the excellent women in the W team of the Access Bank, and you guys are doing a great job. So I would want to share my screen so we can start. Okay. Can you see my slide?
Yes, I can see your slide.
Okay, awesome. So I'll be speaking about polycystic ovarian syndrome and sexual wellness. And I believe that Joy has, given us a brief background that we can work with. And these are the outlines that I would be sticking to. So like Joy had said earlier, polycystic ovarian syndrome affects about 10 to 15% of women in the reproductive age group. And by reproductive age group, we mean women who are between the ages of 15 to 49, especially as defined in Nigeria. One of the important things about PCOS is that about 90% of cases of women who are unable to have children because they are not ovulating as they should is due to polycystic ovarian syndrome. So it's actually a very important topic to be discussing. Many women are affected by that because if you look at, let's say, give or take 90 million, and we say 90% is due to anovulatory fertility, 90% of 90 million is actually a lot. So that's one of the reasons why we're having this conversation. I also like the fact that in recent years, PCOS is no more a hidden entity. There are so many support groups, so many groups for women who they can join, where they can join in and have more knowledge about what exactly they are dealing with. It's important to note, though, that polycystic ovarian syndrome has different ways in which it manifests in different women. So women may have the same diagnosis of polycystic ovarian syndrome, but they may not actually have the same presentation. So it's not a one case fits all kind of presentation. Yeah. Now, for us to define what polycystic ovarian syndrome is, there are the women need to meet 2 out of 3 of these criteria for them to be diagnosed with polycystic ovarian syndrome. And the first one is oligo-ovulation, that means less than, or anovulation, no ovulation at all. Now, sometimes we substitute the marker as oligomenorrhea or amenorrhea. Now that means reduced menses or no menses at all, because it's thought that women who are menstruating regularly are ovulating regularly. It's thought that way. So now when we say oligomenorrhea, we mean that averagely women should have their menses for 3 to 8 days, normal flow. But some of these women we have, and they should have it regularly. That's like between every 21 to 35. Sometimes we've stretched the definition to 45 days now. So either they have less number of days, or they have a longer frequency, a longer interval before they have their next menses. And so we call that oligo. That means it's less than the expected. Now, in terms of the volume, some of these women may have scanty menses. And I'm going to circle back to that later on to also explain some of the complications they may have. And then in terms of how frequent they have it, these women may have periods maybe once in 3 months, once in 6 months. And so that's suggesting that something is definitely going on in terms of frequency. They're not meeting the criteria that they should. And sometimes they may not even have their menses at all. The second criteria is physical or biochemical evidence of hyperandrogenism. So when we say hyperandrogenism, we mean that there are some hormones that we term masculine hormones. So now both men and women have hormones, similar hormones, but in men, there are some hormones that are at a higher level. In women, there are some hormones that are at a higher level. So for example, a woman will have higher levels of estrogen, and not as high level as testosterone. On the other hand, in men will have high levels of testosterone and their estrogen levels are way lower than that. So both men and women have these hormones. It's just the quantity, the level, what is normal range is different. Now, the last one is a polycystic ovarian morphology, and this is what you get on scan. If you scan a woman, there's a way the ovaries look on the scan. So we have follicles are what we see on scan. So they are like small balloon spaces within the ovary that contain the egg. The egg is a microscopic thing. So unless you're looking through a microscope, you really cannot see the egg or the sperm. So they contain the egg. Now we have so much of them, put together in the ovary. And the criteria is there for you to make that diagnosis of polycystic ovarian syndrome. Now, the woman must meet at least 2 out of these 3 criteria. In addition, we should have excluded any other thing that may be the reason for her symptoms. So I'm going to explain that. So for example, we've talked about hyperandrogenism. So let's say a woman has high levels of testosterone that she should. Sometimes if there is a tumor in either the adrenal gland or the ovary that is responsible for secreting that masculine level hormone. We cannot really say she has PCOS because we already know why she has that. So that's why I said it has to be excluded. I hope we understood that. Now, there are some associations with polycystic ovarian syndrome, and this is where most of the advocacy comes in, and people speak about their experiences, and so other people are able to say, oh, okay, this looks like what I have, or this looks like something my sister has. So we have some of these women have impaired glucose tolerance. So the way their body manages sugar is not as well as it should. So usually when you eat your food, your body is supposed to secrete the hormones that will break it down and make the sugars absorbed. But for these women, they don't have that response. So they still have higher levels of sugar in their bloodstream than they should after they've eaten. And this may lead on eventually to having type 2 diabetes mellitus. Also, obesity. Obesity is what I would say is stereotypical. Most people will say, oh, okay, she's big, so she has PCOS. But in actual fact, we have really lean people with PCOS, as we call them, the lean PCOS. So they are not fat. In fact, they don't even have, when people say do exercise for obese people, the reason why lean PCOS people do exercise is very different, because they are not trying to lose any weight. They don't even actually have any more weight to lose. Infertility is also something else, because like I explained earlier, these women are not menstruating regularly, they are not ovulating regularly, so they cannot actually time their fertile period. So I don't know how many of us did biology classes, but then we realized that from biology classes, the menses is kind of like the marker from one cycle to the next. So a woman sees her menses, it marks that, okay, the ovaries are at a particular point, the womb lining is at a particular point, and then as the days go by, the follicles begin to grow. As they grow, they reach a point in which the ovary releases them, which is ovulation. And it is, for those who are trying to get pregnant, they aim for the ovulation period to have sexual intercourse. For those who are not trying to get pregnant and are not on orthodox contraceptives, they also need to know that fertile period, so they avoid it and then they don't get pregnant. So infertility from not ovulating regularly is also one of the associations with polycystic ovarian syndrome. We've also found out over the years from studies and literature that the rate of miscarriage, even when these women get pregnant, is higher than the background rate. Also, their tendency to have complications like hypertensive disorders in pregnancy, preeclampsia, the predisposition to having preterm births is also much higher in them. Now, if you menometrorrhagia, so this is the medical term for it, but if you remember my criteria when I mentioned that these women have scanty menses, one on the flip side, because they have high levels of estrogen, their womb lining gets thick and thick and thick, and it gets to the point where it cannot really grow further. And so they say massive shedding. So even though they've had periods of scanty menses, they can then have the periods where, due to the excessive thickness that has built up and is now shedding, they now actually have really heavy menses, as in so heavy they're changing feminine hygiene products. Sometimes they may even end up anemic if they're not careful because of how much blood loss. And so because of this thick womb lining that has now shed, they bleed heavily and then bleed for a long period. So we get some of women affected by polycystic ovarian syndrome say, oh, I've been bleeding for like 1 month, I've been bleeding for 5 weeks, I've been bleeding for 6 weeks. Sometimes it's heavy with clots. Sometimes I think it's going and then, it comes again. So that's because the womb lining built to an extent that it was so thick and now shed in a haphazard manner. So the common way I explain it to my patients is that if you have bread, if you want to make a sandwich, you have bread, you have cheese, and then you have bread. Now, if you have a thin slice of cheese in between the bread, that's fine. But if you have maybe, let's say, like a 10 mm and 1 centimeter or 2 centimeter thickness of cheese. If you remove that thickness of cheese in haphazard manner, that's similar to what happens during this menometrorrhagia that polycystic ovarian syndrome women experience. Also, research has also been looking into the association with psychosexual dysfunction, and it's still a bit in the neither here nor there phase, and there's still a lot of work that needs to be done. But some of the reasons that as it's being associated with psychosexual dysfunction has to do with body image. Sometimes the women may feel, I'm too big, I don't think I feel attractive, and that may actually dampen their libido and all of that. So a lot of work is still being done and looking into this association. Now, briefly, management options. So as a doctor, I won't be prescribing medications, but I'll be telling us what we can do to make things a bit better. Usually medicine starts from non-medication. Not everything needs to start with a pill. So not everything needs to start with a pill. Please give me a minute. I think I need to mute. So not everything needs to start with a pill. I think I have wrong though. So not everything needs to start with a pill, and then yes, we usually start with diet, exercise, CBT. So with diet, there's no one diet that fits everybody. So you have to actually look for what to modify in your diet. Please give me a minute.
Good morning, how are you? What was your name? Okay, because I got one for that, but the address. The address is 28811. Is it you? Yes. Okay, you just found looking for one? Thank you, have a good evening.
Sorry about that. So diet, exercise, CBT. With diet, you look at how to reduce the oils, the fats. With exercise, usually we do a prescription. So it should be something like do 150 minutes of exercise in a week. You can divide that along the days of exercise, or you can say, okay, I'm only free on weekends, so do that in during the weekend, Saturday and Sunday. Also, behavioral therapy helps. So for women who need a lot of work with, how they think and how they feel about PCOS and how it's affecting their body, this can help them actually have positive ideas about how to live their lives. A lot of supplements are on the market. I'm sure those who are in PCOS groups, support groups would have had many discussions about it. One of the ones I use in my practice is inositol. The burden of scientific evidence also is not as weighty recommending inositol, but as long we have some studies that have said it helped, so and it's not harmful. So in the balance of do no harm, which is the underpinning ethic for medicine, yes, I do use inositol for some of my patients. There are a host of other supplements that people can actually need to actually research it and see it and read about it, ask your physician questions about it. Medications. So the medications are geared toward what is it that the woman wants. So one of the principles of managing a woman who has polycystic ovarian syndrome is, you've gone through a history taking, you've already arrived, you've looked at what it is her symptoms are, and you now ask, what is most important to you? Because with polycystic ovaries, what one woman wants is not really what the other one wants. So if I have a 19-year-old woman with polycystic ovaries, her own concern may be that she wants regular periods. so that when she goes out with her friends, they can buy feminine hygiene products together. She also feels like she's one of them because she's having her periods regularly, like the friends. So her own concern may be regular menstruation. For a 36-year-old woman, her own concern may be she wants to have a baby. So, we will be talking more of fertility options and less of, regular periods. And so the medications are geared toward what it is that the woman wants. In terms of regular periods, there are pills, most of them contraceptive pills that we use. And we give that so that they can have periods once a month. It's important that for women with polycystic ovaries, they have at least one period every 3 months. And I'm going to reach that point in my presentation as we go along. For fertility, there are several options, induction of ovulation, and for some women, they need to do IVF to be able to get pregnant. Weight loss, there are also medications that some women use for weight loss. Now, we've adapted that from more of management for diabetes, obesity, metabolic syndrome. And so, yes, in order to get some of the weight loss effects, sometimes doctors, physicians will prescribe medications for that. Surgery. So for some women with polycystic ovarian syndrome, if you actually do some type of laparoscopic surgery, I won't be able to explain the way it works on this call, but yes, when we do laparoscopic ovarian drilling, it actually reduces the burden of the secretion of androgens from the ovaries, and then that in itself can jumpstart regular menstruation and also jumpstart regular ovulation, and the woman can get pregnant. Another thing we see women with polycystic ovarian syndrome, because of the high levels of the male hormones, they may also have hair distribution that's masculine. So some can use topical creams for that. Some people may require laser for the hair removal. Bariatric surgery is done for weight loss. So if despite everything, the woman is not losing the weight as it should, bariatric surgery can help with that. However, if she undergoes bariatric surgery and is trying to get pregnant, you need to give some time, because there's a rapid weight loss period. And during that period, it's not advisable to be pregnant. So the woman will have to be on contraceptives during that period. Now, for women with polycystic ovarian syndrome, there's some measure of surveillance. We need to monitor their weight so they know exactly how they are doing on the weight loss. Yes, it can be a very psychologically trying period, because if a patient is coming to the hospital, she's like, oh, they're going to weigh me again. I don't want to feel like I failed. So in some instances, you may skip the regular weighing, but it helps to know if they are meeting their goals set for weight loss. Also to do glucose screen. So do a glucose screen to know if the woman has impaired glucose tolerance or she's in the diabetic range. So we can work together with the endocrinologist, work together with the dietitian, the nutritionist, so we can arrive at what is healthy for her, because it has to be something that is sustainable. It's not just I want to lose weight in 2 weeks. It has to be something sustainable for the long term. We also need to look at cholesterol levels, because high levels of certain types of cholesterol is more common in women who have polycystic ovaries too. And so we also have to protect their heart health, so they don't develop clogged arteries that can lead to heart attack. Now, the reason I mentioned earlier that the woman should menstruate at least once in 3 months, and that's because we really don't want that womb lining to keep, to stay for that longer than 3 months. It has to shed. And that brings me to endometrial hyperplasia and cancer. So when the womb lining stays for long periods of time without shedding, it can lead to a focus where, unusual changes in what the cells should look like begins to develop, and that over the long term can transition into endometrial cancer. So that's one of the reasons why we ensure that once in 3 months at least, the woman menstruates. And so that would bring me to the end of polycystic ovaries so that I can delve into sexual wellness. It's very important for women to remember that they should be healthy through all their ages. And one of the ways we classify the age and what we expect with women as they grow from cradle to grave is being classified by someone called STRAW. So we call it STRAW, stages of a female's life. And that moves us from -5 to +2. So I'll just run through this slide so that we can break it down for subsequent slides. -5 is the early reproductive years. That's when you have a girl child. She's still a girl. She's from baby and toddler, and she's still a girl child. And then you go to the peak period, which is a peak period of reproduction. That's from the age of 15 to 49. This is when puberty has set in. The girl child is able to get pregnant, reproduce, and have all her children about that time. Then the late reproductive period, fertility is winding down, and you now move into early menopausal transition. Early menopausal transition, the woman is not yet menopausal, but she's tending towards that. And then you have late menopausal transition, and that's she's had at least 1 year of no menses. Then we now get to early menopause and late menopause. I'm very excited to know that we have someone who's going to be talking about menopause, and I have my pen and paper too, so that once Fam Buki Ayode is speaking, I can begin to take notes as well. So for the early reproductive age, we have wellness checks annually for children. So in Nigeria, it's commonplace that people won't go to the hospital unless they are sick. I think it's something that we should begin to change. Visit the hospital to say, oh, how well are we doing? Are we growing well? Is the weight okay? Is her height okay? Is there anything I should be concerned about? It doesn't have to be that the child has to be ill before you get to the hospital and see the healthcare professional. Regular dental appointments. I know even I, as a doctor, I'm usually terrified of going to see the dentist, but it's very important for our children. It helps us to know if there are any problems with diet that is impacting bone growth, teeth growth. Helps us to know if the oral hygiene is good, if there's anything they need to do. Also helps to be able to institute treatment if the teeth are not well aligned and they have to wear braces. It's usually better if they start that once they are young. Then vaccinations. I'm sure a lot of us must have heard of human papilloma virus now, and it's one of the key ways to protect women from having cervical changes that can lead to cervical cancer. And it's best to give the vaccines before sexual debut, before the girl child or the boy child start having sex, because the human papilloma virus is sexually transmitted. So just like we take polio vaccines, we take BCG for tuberculosis, HPV vaccine is to protect both our girls and our boys in the long term. Also, at puberty, menarche occurs as the first menstruation. We should begin to have appropriate sex education talks with the children. For parents who find it difficult, going to see the healthcare professional may actually be a way to break the ice and discuss appropriate sex education for the age of the child. Diet as well. We need to ensure that in the early reproductive age group, they are having all the classes of food they should, and they are growing as they should. Exercise. In not so distant past, we grew up running around outside, but these days there's lots of phone, video games and all of that. While they are not bad in themselves, we should also begin to institute physical activity into the lifestyle of our children. I added supplements because the call has people from all over the world. So for people who are not in the tropics, they need to pay attention to vitamin D supplementation for the children, so that they are getting all that they require for good health. In the peak reproductive age group, which is between 15 and 49 years old, the women need to pay attention to diet again, diet, exercise, supplements, and especially folic acid. Folic acid is important to prevent babies being born with problems with the brain and spinal cord. We call it neural tube defect. So usually if the woman is trying to conceive, we recommend that 3 months ahead of that, she has started folic acid. In part of the world where I practice in Nigeria, women just get pregnant. They don't plan the conception. So some of them may not have actually been faithful with taking folic acid for 3 months. So, but if we make it a routine and the woman is, consistently on folic acid, even if she does get pregnant, she actually has met the criteria of having a store, folic acid store that can be helpful for the baby. Annual wellness checks, and that has to do with, sorry, I need to move this. So sexually transmitted infection checks. Yes, adults are having sex. That's why we're, populating, and that's why we're reproducing, and it's all over the world. But one of the things we should be doing is ensuring that we're having safe sex. So for those who do not have regular faithful partners, they should ensure that they are using protection. The commonest protection is the male condom. Even as a woman, you should have a male condom. This shouldn't be the guy didn't have it, so we had sex. No, have your male condoms. You are protecting yourself, just like you eat food so that you grow. You take medication so that you're healthy. Have access to barrier protection against sexually transmitted infections. Most of them, yes, are treatable, but there are some sexually transmitted infections that are lifelong. So things like HIV, things like herpes, once it's contracted, usually it has to just be a lifelong therapy, treat some flares when it happens, but it doesn't ever go away. And some of these sexually transmitted infections can then be transmitted to children when those women are now ready to have children. Pap smears, I'm a gynecologist. I know in the UK, they have a fantastic screening system where once the woman is 21 or it's a 25, they're enrolled in the program and they get, regular calls. So every 3 years, you get a mail from your GP that says, coming for your pap smear, you are due. But in Nigeria, we don't have that. So you have to actually have personal agency. You have it on your schedule. I should do my pap smear. And this is when I had the last one. This is what the results said. And these days, the pap smear is to screen the cervix so that if there are any changes before they lead to cervical cancer, they can be treated. So cancer things don't have to get to cancer. There are so many treatment options available so that women don't have to have cervical cancer and die from it. Also, for women who are less than 40, they should have breast scans if they have any concerns with their breast. Actually, all women should know how to check their breast for lumps or masses. It's still one of the low-ball areas of being able to find out if a woman has a breast pathology, if she knows how her breasts feel like every month. So usually you should do it after your menses, but pick a particular time in your cycle. That's because prior to the menses, the breast is usually congested, lumpy, but once menses has come, the congestion goes down. So if you're consistent at doing it every month, if there is anything in the breasts, any lump, any change, you are likely to find it. Unlike if you do it once in 3, 4, 5 months. So yeah, that's one of the things that women should also do during this reproductive age group. For those who are older than 40, they should have mammograms. If there is a history of breast cancer, the frequency of mammograms may increase. That's if there's a history of breast cancer in the family, the frequency at which they have mammogram may be a bit higher than what is usual for the normal population. Also contraception. So this is the age where women have the children they want. If they are not trying to have more than they already have, they should actually have a a method of contraception that they are using. They should understand what it is, know the side effects. Some of the reasons why women discontinue contraceptive method has to do with not having known what side effects to expect. And so they, in that hurry, they usually will take it out and then fall pregnant and have an unplanned pregnancy. For those who are trying to have children, this is the age where they have fertility evaluations to know why it is or what the likely reasons for not being able to conceive by themselves are, and to have the appropriate therapy for that. For those who do get pregnant, it's important to have quality antenatal and postnatal care. That's what keeps our women alive. I tell my colleagues and my patients that women having children is national assignment, because if we do not have children, we can't increase the population, and then 20, 40 years down the line, there really isn't anybody who is doing the work because the population has shrunken. So it's national assignment, and we should pay attention to the quality of care that we receive, so we do not lose women to pregnancy-related issues, and so they can live longer, be more productive members of society. There are also some other checks that are history related. So, if a lady has a sister or an aunt or their mother who has breast cancer, they can do further testing like BRCA gene testing to know. One of the most popular people who have opened up about that is Angelina Jolie, who had lost her mom and her aunt to breast cancer. So she went ahead and did the gene testing, found out she carried the same gene, and then went ahead to do a mastectomy. So she doesn't have breast cancer, and she's still well and alive today. For those who have a history of colon cancer, they can begin to do their colonoscopy and follow up with their physicians. Next. Yeah. So menopausal transition, we have the early and the late, and it's variable length of time in different women. So just like women are different heights, different weights, they don't all arrive at menopause at the same time. And I like how Mrs. Gisari said earlier that we need, just like death, and let me add, taxes are a part of life. Menopause is a part of life for women. No matter how young they are now, they eventually will end up at menopause. Early menopause, this can happen when it's occurring before 45. And then menopause usually happens from 45 upwards. Some people may get their menopause at 55. Very few people are having to get to 60 these days. So I think the age at which menopause occurs is dropping. Like I said, it's a variable length of time. Some women have this transition over a year, some 2 years, 3 years. During this period, they should also stay on contraception. So I found people who use a particular contraceptive method and they are no longer getting their periods, and they think they have arrived at menopause, and they take it out and they have a retirement baby on their hands. So contraception is an important thing that women should look out for, and until they are sure that they have arrived at menopause, they should keep the contraception in. Regular checkup for chronic illnesses like hypertension, diabetes, and any other chronic illness is also very important in this period. The early postmenopause lasts about 4 years. So that means menopause, a woman has experienced no menses for 1 full year. So we actually have to count the months. It's not just, I saw my period last year, which may be November last year, and we are in September. It's not yet a full year. So she has to have had no periods for at least 1 full year. And then the early parts of that postmenopause may last about 4 years. During this period, depending on her symptoms, she may require hormone replacement to be able to cope with the symptoms, diet and exercise, because once women reach menopause, the level of estrogen hormone begins to decline. Really, that's the evidence that they're menopausal. And the bone strength we get from estrogen begins to also get less. So diet and exercise helps us to be able to retain that bone strength in such a manner that fractures are not as frequent as they are. There are so many supplements too that women can use that may mimic estrogen and so may be able to help with that. So diet, exercise, supplements are the other things to also look out for in late menopause. I'm not sure if, I think that's the end of my slide. Thank you so much for having me. I think I overshot my time by about 2 or 3 minutes. I apologize for that.
Yes, thank you so much, Dr. Mojisola, for that insightful presentation. I can see lots of questions, which we will take right after the session. But I would like to mention to our audience that the link for the free screening is still on the chat in the chat box. Please click it if you want to access any of the free screenings we have in this month of October. You can click the link and fill your information. We also have the feedback form being deployed in the same chat box. Please, we want to know from you, want to hear from you. Are we doing good? What do you want us to do better? We would love to get your feedback. Thank you so much for that session once again, Dr. Mojisola. So I would like to welcome my next speaker, who will be speaking to menopause. Dr. Mojisola mentioned quite some things about menopause, but let us hear from Fambuki, who would speak directly on that topic and all that we need to know about it. So with your virtual claps in the chat box, please make welcome Fambuki Ayade. I can't see your claps, so.
Thank you, Joy. Thank you. Wow. Dr. Aderobu, she's done the whole job. I just need to pack up and go. I've learned so much, and obviously she's covered a lot of what I have here. So it's probably, but what is good is that it then begins to inform women to know that, you know what, it's not the information is the same. we just need to do the do. So Joy, you did a brilliant introduction, so I'm not going to labor that point, but I just wanted to focus on the last 2 sentences on this slide. My passion, I believe why God has put me on this planet Earth, is to see women live in health and well-being, and especially midlife women. No midlife woman should be left behind on my watch. I want to take the opportunity to say thank you to Access Bank. Thank you to the W community and the phenomenal work that you're doing. It really is amazing work. I'm just mind blown by the investment and the consciousness to bring a focus to women and to women's health. So thank you. And thank you for the opportunity to share my few nuggets with you. You mentioned Vibrant Midlife. Vibrant Midlife is a wellness practice that is faith, evidence, and we tend towards lifestyle in the way that we practice. And we do that by, we're focused on the midlife woman. That's the woman from the age of 40. And it's menopause awareness, menopause workshops, coaching women, and consultancy to organizations so that they learn how to support their women and keep them in the workplace. So I'd like to kind of start from this point and stress that our physical, mental, spiritual well-being and fitness supports our life's mission. So it's not something we should leave to chance. We must prioritize it. So I'll leave that there for a moment, let it sink in. I'm now going to just share some of the data, or some data, again, just to lay a foundation and to give us an idea of the import and why this is important, why we need to pay attention. I talked about midlife women. A midlife woman is somebody from the age of 40. I gather that the Access W community is a vibrant community, or from one age to the other. Because I said it's from 40, please don't switch off. Don't check out, because if you whatever I share, whatever Dr. Aderomu has shared, you've got a head start. You're ahead of the game, and also you can use that information to support your colleagues, your senior colleagues, to support your senior family members, and also if there are men on the call, please don't check out either. Listen, be informed, and take on board this information so that we can begin to support one another to build a holistic and healthy community. So we talk about non-communicable diseases. The NCDs account for the highest proportion of deaths globally. I'm not sharing these facts to scare. I'm sharing these facts to give us an understanding of why we need to pay attention and why we need to focus on our health and well-being more so than ever before. 17 million people die before the age of 70, so which is termed as premature death. And 86% of those premature deaths occur in low and middle income countries. And what are these diseases? What are these NCDs we're talking about? Cardiovascular diseases. Dr. Aderomu, she talked about all of those. Cancers, respiratory diseases, diabetes. These are the things that are killing people worldwide, and more so in low and middle income countries. Those are the facts, caused by lifestyle factors. We are inactive. We eat whatever rubbish we feel we want to eat. We drink however we want to drink. We might decide we want to be smoking. There's pollution in the air, we cannot begin to tell me about, bad air as a result of, we were burning generator fuel, just all sorts of smog going on. And these are the things that increase a person's risk from dying from an NCD. I'm now going to just bring a link to NCDs and menopause. So we will come to the ages in a moment, but a woman will spend, given if she has a decentish longish life, will spend a third of her life in that menopausal transition phase. And at this point, because of the drop in hormones, is when several metabolic and cardiovascular disease risks emerge. So we're talking about, again, the obesity, metabolic syndrome, diabetes, osteoporosis, because, we're losing bone mass. We get, the cardiovascular disease, cancers again. So WHO has talked about what it has said. The data is also saying that when a woman arrives at this phase of life, the propensity for these diseases increases. And the writers of this paper, they gave a really lovely sentence that I like. They said, the occurrence of the menopause heralds an important opportunity to institute preventative strategies. What are these preventative strategies? Lifestyle modification. I would even go much further to say, before that time, let us begin to imbibe and inculcate and bring those things on board, so we come to this point and we're a step ahead. So I just want to invite you on a journey. Just come with me. It was about 2012, 2013. I was actually working and living in Lagos at that point. And I remember, I would walk, I had a role where I had to walk into offices and go and talk to people, and I would walk into the office. You know how Lagos is, you're coming from the heat into an air-conditioned office. And I would just have beads of sweat on my on my forehead, and people are like, "Are you okay?" I'm like, "Yes," because then I was having flushes. I used to love coffees. I used to love lattes, cappuccinos, and all of that. And I just found that I could not tolerate milk anymore. I had really bad gut issues, bloating. I would feel so uncomfortable. I would eat, I would feel uncomfortable. I also had this terrible joint pain. My elbows would be aching so badly. My shoulders will be aching so badly. You know, and these are just some of the symptoms that I personally experienced. But I would, you know, just by learning, researching, understanding my body, I was able, because I know when Joy spoke, she introduced me as a pharmacist. I've been a pharmacist for 30 something years, thereabouts. But anyone that knows me will know that I'm the pharmacist that doesn't like to take medicine. So I'll be the one looking for the natural solution. I'll be the one looking for, okay, what can I? So yeah, I just took time to research and reverse those things with lifestyle. At the moment, again, to the intro, I get to lead a work stream on the National Menopause Program, where we are creating interventions for our women at the National Health Service, because we have recognized that we need to support these women to stay in work. Menopause now has become a huge workforce retention issue, because women in the age bracket of impacted by menopause are the fastest growing workforce demographic. So we need to support them to stay in work, but not just stay and be limping on a whatever. They need to stay and they need to thrive. So what have we done? We've instituted, you know, we've been responsible for guidance, leading to policy. We've created learning for managers, learning for women. We've created networks. We've supported the people. We have tools that we've created for clinicians. And we are also looking to embed a menopause supportive culture across the whole NHS workforce. I just thought to touch on Dr. Aderomu she's done this job for me, to be honest, but touch on some of the menopause basics. And at this point, I would also recommend that you check out Healthpedia, this edition, because I did a write-up in there where you can find more about this aspect. But let's just unpack it. The period leading up to the menopause. So the menopause, as Dr. Aderomu said, is one time point. But the period leading up to the menopause is the start of that transition. That's when you start to experience symptoms. So you have symptoms, but you still have periods. Your periods haven't stopped. Usual age range is 45 to 55. Some women experience menopause earlier, and I will touch on those later, but the usual age range is 45 to 55. And perimenopause, so that period perimenopause ends once you reach the menopause. You reach the menopause when your periods stop, but you have not had a period for 12 consecutive months. So Dr. Aderomu mentioned that we need to count the months. You need to, you miss period month one, you tot it down, and you carry on. Once you've had that 12 months consecutive, at that time point, you can say you have hit menopause. Anything after that is postmenopausal. You're postmenopausal. A woman will be postmenopausal. The usual age talked about is 51, but in Black women, it's actually it's lower. So Black women come to that time point earlier. So we're looking at the data at the moment is saying 49.6. So at that kind of age. Early menopause happens when under the age of 45. And a woman going into menopause under the age of 40 is termed to experience premature menopause, or it's called POI, premature ovarian insufficiency. And then just to touch on surgical menopause, which can be as a result of gynecological conditions, or family history or genetics, or as a result of treatments. If a woman has cancer treatment, she can be shocked into menopause. Women have fibroids and that are so troublesome that they have to undergo surgery. A woman can be shocked into menopause at that point as well. What are the common symptoms of the menopause? I like to tend to class these into physical, psychological, and vaginal. So this list is not exclusive. It's not exhaustive. I beg your pardon. there are, some lists, there are 35, some are 40, over 35, tending to 40, over 40 symptoms of the menopause. But typically you would hear about hot flushes and night sweats. I talked about changes in periods. Some women might, periods become erratic. Some have, less periods. Some have really, really heavy flow. And what's going on is the hormonal fluctuation. Some women might experience joint pain. Some have low energy. Some have low libido. So some women start to experience heart palpitations. And the reason why we have symptoms affecting different aspects of our is because our hormones are found in many of our body systems, from the top of our head to the soles of our feet, impacting various things and various areas of our body. The psychological symptoms, anxiety. Some women start to experience really bad anxiety. Obviously, we know about the low mood. 1 minute you've got your low mood, the next minute you're up there. Some women, they just can't get their hormones to balance. And I want to touch on low mood because a lot of the time women will present with low mood and they're prescribed antidepressants, which is not necessarily what you need at this point in time. So if a woman does not have a diagnosis of depression, she really doesn't need antidepressants to manage low moods or mood swings. You find that women can be a bit irritable at this point, start to experience, cannot find it difficult to focus, concentrate, memory. Then look at the vaginal symptoms again. Discomfort down below, itching, frequency of urinary frequency, urgency. You just feel that you're busting to go to the loo. You find some women experience repeated UTIs, and then some women might have painful intercourse because there's vaginal dryness going on. It's all of that whole thing is called GSM, genital urinary symptoms of the menopause. And what I want to just say is that a lot of these things can be quite impactful on a woman's life, can be impactful on relationships. So a woman that's experiencing vaginal symptoms, for example, and is feeling not so confident to have a conversation with her partner or husband, you can't have a headache every night. So we need to be aware of these things, and we need to be looking to how we manage these things. We need to be aware and make others aware so that they know that this phase I am going through, I am experiencing one thing or the other. What I would also say is every woman's experience of the menopause and her symptoms are unique. But what's key is awareness. So how do we navigate? How do we navigate the menopause? That's the task that Oyi and team have given me. So we at Vibrant Midlife, I've just got something that I've called a MAPS solution, and I call it a MAP solution because it ties in with navigate anyway. So that's that, but it also just gives us a framework to understand. For me, and when I speak with women, my starting point is always up here. What is going on in terms of what are we thinking? My default is I will be well. God has ordained and promised that I will live in health and well-being, and I will be well. So that is where I start from. I'm not taking away the fact that we don't experience symptoms. I'm not belittling anyone that experiences symptoms that are very, very impactful on their quality of life. But if we come from a place of I will be well, if we come from a place of, you know what, I need to find solutions, it's quite helpful. That mindset informs our actions which informs our results. So let's embrace that positive mindset as we approach this phase of life. Then we move into the next step, which is awareness. We need to know what's going on in our bodies. We need to be aware of what is the menopause, what are the symptoms, what are my own baseline numbers in terms of my blood pressure, so when we talk about general health and well-being, and Dr. Adero, she stressed it time and time again, wellness checks, annual, she said. I was somewhere I think it was last week or a couple of weeks ago, where someone said, let your wellness check be your birthday present to yourself. At least we celebrate birthdays every year. So that could possibly be a reminder. But we need to know our numbers. We need to know that our numbers are within range. And if they're not, there are always solutions. When it comes to menopause awareness, you need to know what are the symptoms. You need to know what are your own symptoms. Because when you're aware, when you know that, a woman that's, hit 40 starts to notice things coming through, and you start to track those things, it aids the conversation when you have a conversation with your healthcare professional. When we are aware, and if we have symptoms that are impactful, or we have numbers that are not where we want them to be, we then have to create a plan. And your plan will be, again, bespoke to you. It needs to be personalized to you. It needs to be informed. And you would typically work with a knowledgeable healthcare professional to come up with a care plan, a wellness plan, or a menopause care plan, or in some instances, these things can be combined. When you create that plan, it needs to, we need to be thinking, as we're creating the plan, we need to be thinking lifestyle. We need to be thinking this plan, it should be sustainable. So those fad diets, they're not sustainable. So that's not necessarily what we would recommend. And then underpinning all of this is to begin to tweak things and make lifestyle changes. It can be quite difficult. So I would always recommend and advocate that we seek support. We seek the right support. We seek knowledgeable support to help us. And truly, I actually think that support and getting accountability is the glue that makes our plan stick. Because left to our own devices, we know what we can be. And so I've got that image in there that talks about, I come up and Vibrant Midlife, we come at menopause from a positive perspective. If you Google midlife right about now, you will find that the first thing that comes up is midlife crisis. And I'm like, no, I'm not going down that negative route. This is an amazing time, it's an amazing period of life, depending on how you want to look at it, the lens you want to apply, and how you want to approach it. So in terms of practical things that I've done, this is what I've done that I thought, because when you said, share some things, so I put this here. This is my perspective. Obviously, I've said everyone is unique, and your management approach will be the same. But I have an emphasis on lifestyle management and natural things that will help me live well and live better. So I talked about my gut issues. So what did I do? I had a gut reset. So that was a whole protocol of how I reset my gut to just think, okay, you know what? I just need to bring in some things, take some things out. If I would say anything around diet, I would advocate eat more plants. Eat more plants. I'm not saying people go vegan or vegetarian, and I know we have a meat eating culture, but we have to balance our plates these days. Balance our plates, help balance our blood sugar, because when we balance our blood sugar, we help our symptoms. eat more proteins. We eat more proteins because we lose muscle mass as we lose estrogen. So protein helps us build muscle mass. And you just introduce certain things and take some things out. I then also, to help with just my weight management, and also with how I was having digestive issues later on in the evening, I condensed my eating window. So those are some of the things that I've done myself. In terms of pain, elbow pain and shoulder pain, what I found that was helpful for me were actually lifting small weights. I have this gym bars, and there are other things. They're called resistance bands. It's painful when you start, but that was actually what helped me get rid of the pains. So it's just using the joints. So we find that when you use the joint, it's kind of counterintuitive, because the thing is hurting, but you're stretching. But that was with consistency. That was how I got rid of those. I walk a lot. I seize a lot of opportunity to walk. I know that might be difficult in Lagos, but even so, shouldn't be difficult in Lagos. Just wake up early before the sun comes out and walk, or in the evening when the sun goes down, walk, or find a walking machine indoors, walk. So because we can come with excuses, but there are always workarounds. And walking helps me. It helps my mental health. It helps my bone health, muscle health. I talked about the gym bands, the resistance band, the gym bar, the small weights. I use that for stretching and strengthening. I am the queen of self-care. You cannot put any stress on my head. I don't want. So I manage my stress and manage it well. And whatever we're doing, we have to make sure that, I've said it before, it's consistent, and so that we have a lifestyle approach so that we can sustain for the long term. And honestly, I would say that I am 10 years fitter. I'm fitter now than I was 10 years ago. And that is the honest truth. And this December, I'll be 59 years old. And so, we've created community to raise awareness, and we share nuanced information, and that's a code that can take us to community. But the code comes through, it's even in the background anyway, so you can catch that from there. So I know you've listened to me, and everyone talks about lifestyle, and there's this and there's that, and I can't do. It's like, it's okay for you. Maybe you're not busy, you haven't got this going on, or that's not going on. But honestly, my question is, what is your why? My why, I've talked about, my mission. I have a lot of work to do, and I need to be mentally, physically, holistically, I need to be well. So I, rather than me, when I'm called upon to do stuff, I'm having to deal with chronic illness. No. My why is also my children are at the age now when they will start having children. I need to be the grandma that is running with the kids, with the grandkids. I don't want to be the grandma that is having to go to hospital appointment when I should be available for my grandkids. And honestly, we need to think about it. What is your why? Each of us as individual women, what is your why to having that helps you focus on and prioritize your health and well-being? And I say this, I say it, I've said it there. If we don't make time for wellness, I say make time for wellness so we don't have to make time for illness. We have to be proactive, we have to be intentional. We book every other thing. The hair, the nails, the tailor, we shop for all manner of things as women. So I would be saying, I'm saying it, we must invest in our well-being. We must be proactive. It was lovely to go on Access Bank, the W Community Wall, and see those health packs that they have at different levels. And listening to all of the various things that things that they have available. So as you are planning your spending on the hair, the nails, the bag, the shoe, plan the spending on your well-being. Plan the spending on, let me know what's going on in my body. I spoke about menopause being diagnosed by symptoms. We have a free symptom tracker on our website. You can go there, grab the tracker, and at least begin to note if any of those things apply to you, so that when you come to sit down to have a conversation with your healthcare professional, you're having an informed conversation. This person thinks, the person is looking, the clinician is looking at you thinking, yes, this is a woman that she's got it, she's all there. So please seize the opportunity to grab the tracker. So as I go, so I spoke about my approach to menopause care, which is lifestyle. That's not taking anything away from prescribed medication, which is HRT, and I'm sure and Dr. Adiromu touched on that as well. But I would always lean on lifestyle, and then if we've not resolved the symptoms and there are still symptoms that are impacting a woman's life significantly, then we can have a HRT conversation or signpost her to a specialist who she can have a HRT conversation with. So I'll say, I've said all of what I've said to say, we can listen to all the information there is from now till eternity, but if we don't take action, nothing is going to change. So to women, I would say, get involved and be a part of the menopause conversation. Learn, come to awareness sessions, find out, connect with at least with us. I mean, that is my main thing, is to create awareness for women in my community. Take menopause awareness and your menopause care seriously. There is a lot of information out there, so I would highly say beware of where you're getting your information from. Dr. Google is not your friend, and the information from your girlfriend next door it might not necessarily be what you need. So you need to work with expertise. But in as much as there's a lot of information, let it not fly over our heads. I always say this, well-being, health and well-being requires action. It's not an anointing that will just fall upon anybody. We have to be proactive. We have to play our part. Join our community. There's the opportunity to be a part of what we're doing, because this is, as I said, this is my life's call. And if I don't know the answer, I will know somebody that knows the answer, and so signpost you to credible practitioners or sources of information and support. Are you a female leader on this call, and you have a group of women or teams that you care about? Let us at least give an information session, or run workshops, because an information session, okay, we give the top line, this is this is that, this is the other. But in our workshops, we begin to delve deeper into, I talked about that menopause care plan. That's where women start to crystallize what their care plan can look like. And to organizations, I mean, Access Bank, I doff my hat. You guys are doing the most, but there is always more. We can always do more. We can always do better. So, and it's important because, women, we are living longer. Women are staying in the workforce longer. Support them. That's the expertise that you have. You support them so you retain valuable skills. You retain valuable talent. You retain valuable expertise. These are the seniors that will mentor the ones coming along to make your organization a viable and vibrant and thriving business. Again, bring us in for your awareness sessions or workshops. It's a good starting point. And if you are looking for more wider initiatives for that community, because I think you called it, what did you call it? You called it the quintessentials. I love that, actually. If you're looking for wider initiatives for the quintessentials, bring us in. So you've listened to me talk and rabbit on for so long. As I'm always about action. So I guess I would ask you to pop in the chat. What one thing will you commit to do today as a result of what you've heard? Is it your diet? Is it your exercise? Is it your menopause awareness? Is it downloading the tracker? What one thing will you commit to do today? And yeah, that's it. And if Joy will allow, Joy, will you allow them to unmic?
They would probably would see all the comments in the YouTube chat box.
Okay.
Thank you so much. Thank you so much, Fambuki. It was really an insightful session, I must say.
You're most welcome.
The comments section is buzzing with questions.
Will I stop sharing?
Yes, you can.
Okay.
People are excited about what they've learned today, and I'm also very excited. I particularly love the acronym on navigating menopause. That's the MAPS. Very, very thoughtful. Very thoughtful. One of the things I also picked is, you said let your health check be a birthday gift to you every year. Very, very key, very important. Thank you so much for the presentation. We really enjoyed it.
You're most welcome.
And I want to say thank you to both of our speakers. They did justice to the topics today. And we have lots of questions for you, our speakers. So get ready. Get ready for those questions. Now, this brings us to the end of the presentation for today. And I'm very sure everyone here has learned one or two things from this topic, as I have. Before we dive into question and answer, I would like us to take a moment to fill the feedback forms being deployed in the chat room. Please, I would like to give us like 1 or 2 minutes, go through the chats, fill the link being deployed. It's a feedback form. We would like to get your honest feedback so that we can incorporate this into future webinars. So thank you so much to our cooperative audience. Thank you. So let's dive right into question, right? While people get to fill the feedback forms. My first question will be for Dr. Muji. Somebody here says, what are the side effects of the drugs used in IUI? I'm gonna read 3 questions so we can answer them together, right? Dr. Muji, so first question for you is, what are the side effects of the drugs used in IUI? How does one get pregnant while experiencing irregular period? Did you get that?
Yes, I did.
The third one is, what could be some of the causes of painful menstruation for a 31-year-old? So I'll leave you to answer those 3.
Okay. So thank you for the questions from the audience. I think the last one is out of the scope of the topic for today anyway, but I'll do my best to answer it. Side effects of IUI medications. With intrauterine insemination, usually we'll do ovulation induction. Medications can be either tablets or injections, but they mostly work around your hormones, making sure that a certain hormone is high enough to recruit number of eggs so that you can have so number of eggs that you can ovulate. With hormonal medications, you have the same symptoms like, mood swings, you have swelling of the feet, you can have pain if you're taking injections, pain at the injection site. It's not usual to have, those are the common ones. There are usually some other symptoms that maybe during drug testing happened in 1 in 1 million people or something. So those are not usually as common. The common ones are the ones I've given you: nausea, vomiting, headaches, mood swings, swelling of the feet. Most of them usually are, you can cope with it as long as you knew what to expect. I think one of the things we physicians can do better is communicating what to expect with our patients. It's like if you are traveling down a particular road, if you know that there's a place where there's a bend, there's a place where there's a gutter, there's a place where there's a dog, that if you stay on that side, the dog may bite you, but if you move a little 5 centimeters to one side, the dog is on the leash and will not be able to reach you. Those are things we as physicians, and that's note to self as well, we can do better with communicating those side effects to the patients. And once they know what to expect, even when it happens and it's very uncomfortable, they're like, oh yes, the doctor said I should expect this. Okay, so this is what I can do about it. So I think that's the best way to answer your question. How to get pregnant with irregular periods. Like I said, the periods are a marker. So we kind of use them like a substitute marker to say, is this woman ovulating? Because we expect that if the periods are regular, the woman is ovulating regularly. So if the periods are irregular, we first need to find out why. Because polycystic ovaries is not the only reason why women have irregular periods. So we need to evaluate, why is she having irregular periods, or why is she not ovulating regularly? And it's answering that question that then lets us know what to do. So it's like, I'll use a common example of malaria. We know malaria is caused by the mosquito, Anopheles mosquito. Now, if we can protect ourselves from the Anopheles mosquito, we won't get malaria. So if we're able to find the reason for the irregular period, then we can deploy corrective measures for it. So for polycystic ovaries, we know why. So for us to get regular periods, then we can use the pills. There are other reasons why a woman may not have regular periods, and then we can address that. With causes of painful menstruation, it can be what we call primary or secondary. So primary means that the woman has always had painful menstruation from when she started her first period. And then secondary means that she didn't used to have pain, but then as she grew older, many years into having menses, she starts to have pain. So the reasons are usually not the same. So for those who have had pain right from the beginning, we need to evaluate, is there a problem with the tract? Is there a, how can I explain stenosis? Is there a occlusion anywhere along where the menses should flow out from that is giving her the cramps and the pain? And, if we evaluate that, we can have an answer for it. For women who have secondary, as they usually were pain-free and then developed pain along the way. One of the most important things we need to actually exclude is endometriosis. We need to know, does she have endometriosis or not? If she does, what is the stage? Because the staging will now help us know how to treat her best. Is she going to need surgery? Is she going to need medications to block out the hormone control? How long can we put her on those kind of medications for? And so those are some of the things that we evaluate. It's you need a very patient gynecologist to be able to arrive at that kind of diagnosis with you, and also a good plan of what your expectations are, how to figure out if those expectations are being met with your treatment plan, and what else to change.
Thank you so much, Dr. Moji, for those answers. I hope the people who asked those questions have been your question have been answered. I have the next 3 questions here for Fambuki. What can a young person who hasn't menstruated for about 3 years do to resolve this? A young person who hasn't menstruated for about 3 years do to resolve this. What are some of the causes of premature menopause? And what are the chances of someone who's had early menopausal symptoms getting pregnant later if they aren't ready to conceive it? So I'll read that again. What are the chances of someone who's had early menopausal symptoms getting pregnant later if they are not ready to conceive yet? Did you get those 3 questions, please?
Okay, so the one from the top, the young person, I would say speak to Dr. Aderom. I would say speak to Dr. Aderomu. The young person that has not had periods needs investigation, definitely. So she needs to be referred to a gynecologist. So that's answered that one. Let's talk about number 2, please.
What are the causes of premature menopause?
To be honest, the data is not conclusive. A lot of the time it's talking about, it could be genetic factors. It could be, they're talking about aspects around having that gene that relates to Down syndrome. That could be one of the causes, but the data is not conclusive. It's not, it could be family history. I talked about that, the genes. It's not, there's not inconclusive data. But if what is important is for a woman to recognize that, you know what, I'm skipping periods at this young age, and to seek help. And that's why these conversations are important.
Okay, that's that's noted. The third question is, what are the chances of someone who's had early menopausal symptom getting pregnant if they are not ready to conceive yet?
You can't hazard a guess at the chances of, but what you could do again is seek specialist support. So people are harvesting eggs, for example, or they're having treatment to boost their eggs so that they can harvest eggs and freeze eggs so that when they are ready to then have the conception. Again, if you're experiencing early menopause and you want to have children later, you're not ready to have children now, you would need specialist intervention. Definitely have the conversation with a specialist and see what are the options that are available for you in terms of managing that situation, boosting eggs, all of that kind of aspect. Am I right, Dr. Aderobu?
Yes, Ma, you're absolutely correct. And in my practice as an IVF physician, it's also one of the things we do at Medical Art Center. So even for women, not necessarily those who are experiencing menopause early. So for who at a period in their career, they really cannot, they are not going to be able to raise children at that time due to their circumstances. And they don't want to give up on having their own genetic children when they are much later. So they come in, we do IVF, freeze the eggs. If they have a partner or are married, then we can, fertilize the eggs and have embryos and freeze it. And they're ready to start having kids. Then they come back and get their embryos, get pregnant. It's also what answers the first question directed to me. So yes, you need evaluations with gynecologists who answer, the person who asked that question. You need to know why you're not having your menses. It may not necessarily be premature ovarian insufficiency. It may be a structural abnormality going on that can be resolved by surgical procedures. It's best to have a gynecologist review you, do your scans, do your hormone labs, and be able to tell you, okay, this is what I think, this is what is doable, this is what you can do for now until you're ready to have children.
Thank you. Thank you to both of our speakers for answering those questions. I have the 3 next questions for Dr. Moji. The first one says, is IUI advisable for a woman with PCOS and is 35 years and above trying to conceive for 6 months plus? Okay, so the question is IUI advisable for a woman with PCOS that is 35 and above trying to conceive for 6 months plus?
Read the 3 together. Oh, I should go ahead.
Okay, so the second question is, how important is inositol in managing PCOS? I don't know if that's a drug.
Yeah.
Okay, so how important is that drug in managing PCOS? And the third question is, what is the relationship between the use of emergency contraceptives and PCOS? What's the relationship between the use of emergency contraceptives and PCOS? You have the floor.
Okay, so IUI, PCOS, age is the most important factor. As women grow older, the fertility potential declines, and that's how God made us. And that's why we have that age, reproductive age, peak reproductive age. Now, in my practice, I usually will not just take away an option because of age. I also believe that physicians don't play God to that extent. Now, if all the evaluations have been met, and there's a good chance that this woman, although she's 35, her tubes are fine, her antral follicle count is good, her AMH levels are great, why not? I won't be insisting on a PCOS if she has a chance at doing, I won't be insisting on an IVF if she has a chance doing an IUI. And we can have a realistic discussion about it, that, okay, with age, the chances get lower. I would recommend maybe 2 cycles. If we don't get pregnant in 2 cycles, then let's not waste time doing the same thing over and over again. Because if the longer you stay at that level, by the time you are now ready, the follicle count is, it has gone haywire. So it's what you call a didactic discussion between the patient and her physician. And age is not the only reason to take away an option from a woman who is trying to get pregnant. I think that answers that question. Inositol, it's a supplement, like I said, just like you buy different supplements, you use garlic supplements, you use ginger supplements. The bulk of science review has not come out to say, oh yes, inositol, it's a treatment for PCOS. So it's a supplement that you can use, but you should use it after having read. So I won't be the one who go and read it and come and tell you. You have to take up some of the responsibility for yourself. Read through it, ask your physician questions, and see if it's something you want to try. If it is, that's fine. Like I said during my speech, it doesn't harm you, but it may not necessarily give you the benefits, eureka moments that you are looking for, but it won't harm you. Relationship to emergency contraception and PCOS. First of all, because I'm a gynecologist, I'm happy that someone is mentioning emergency contraception. I also want to say that since you know about emergency contraception, then you should be looking for a permanent long-term method, not to use emergency all the time. So please, you've taken the first good step. Please take the next 2 good steps to the contraceptive conversation. Now, with PCOS, they have irregular periods. It's also a side effect you can get from using emergency contraception. So if a woman has PCOS, uses emergency contraception, we may not, things may get clouded. So, but if you are having PCOS and you're having sex, you don't want to get pregnant, choose a method, a regular method that you can use, so that during evaluation, things are not, clouded by, is it the PCOS, is it the emergency contraception that is giving the irregular periods?
Thank you so much. One more question, and that's the last question for you, Dr. Mochi. So someone says, does PCOS lead to repeated miscarriages or stillbirths?
So we don't in medicine, there are very few times we say A plus B equals to C. But sometimes we have things that we call associations. So it's like the Yoruba proverb is, the witch cried at night, the child died in the morning. So who killed the child? There's a Yoruba proverb like that. So yes, with PCOS, we found that because of the hormone dysregulation, there's been a slight increase. Yes, people who don't have PCOS have miscarriages, they have preterm births, but with those who have PCOS, when they get pregnant, that hormone dysregulation still predisposes them to a slightly higher risk than the background population for that. So it doesn't mean that if you have PCOS, you will have a preterm birth or a miscarriage. I've managed many PCOS women who either by ovulation induction or IUI or IVF. But because I know the hormone dysregulation predisposes them to that, then we take the necessary steps to ensure that they don't have a miscarriage, and then we can monitor them all through pregnancy. So it just increases the risk. It doesn't mean that once it's there, A plus B equals to C.
Okay, very explanatory. Thank you so much, Dr. Moji. Thank you for your time. I'm afraid we'll have to round up. There are lots of questions for you, but please let people know how they can reach you if they need to reach you.
Okay, so you can email, I don't know if someone's going to type that in the box. You can email info@medicalartscenter.com, center, CENTER.com. And you can write attention, Dr. Aderomo, and the email will get to me.
Thank you so much, Dr. Moji. Fambuki, we'd like to also know how people can reach you, if you don't mind.
There's a code up there behind me.
Okay.
But if you don't want the code, it's vibrantmidlife.com/contact.
Okay. vibrantmidlife.com/contact.
Or scan the QR code. Or on Instagram, I'm at vibrantmidlife.
Okay. Thank you so much.
You're most welcome.
Please, can we have a round of applause in the chat room for our wonderful speakers? They have really, really done well today. And I must confess, I've learned a lot. This session has been very, very insightful and impactful. And I'm so glad I'm a part of this session, because what I've learned today, I'm not sure I've learned it anywhere else. But thank you so much for the presentations. They were really, really insightful. To our audience, please follow at the W community on all social media platforms. Don't forget to follow us. This webinar is cut to the W initiative. So please follow the W community so you can get updates on different events, different programs that we're going to be having monthly, weekly, and the likes. Don't forget to click on the links in the chat room so that you can participate of the free health screening and discounted health screening going on right now in the month of October. You do not want to miss it. Also, subscribe to this YouTube channel and like this webinar video if you had really gained something from this session. So thank you once again for listening. Thank you to our amazing audience. I'm clapping for you guys. Thank you so much. Now, to round up the session and give us the closing remarks, I would like to introduce the group head of the Women Banking Team of Access Bank in the person of Mrs. Abiodun Olubiton. Please give her your virtual claps in the chat room, please. Thank you.
Thank you so much, Joy, and good evening, everyone. Dr. Moji, nice seeing you, spilling it out all for us. Thank you so much. And Fambuki, wow. I felt like this should actually be a physical session where we can actually exchange some very warm hugs. Thank you so much for your time and for sharing, very freely, with very practical examples. I hear PCOS a lot of times, and in all honesty, I don't think I paid so much attention to it. But by the time we started, thinking of what we were going to share with women, and I was checking, I said, wow, this is a session not to miss. I'm sure a lot of the audience will know some of them that I had to reach out to say specifically, call girls around you, make sure they are on the call today. This is something that every woman should learn about. Even our men should learn all of these things for the sake of their spouse, for their sisters, for their children, so that they understand some of these things. When you're going through it, they can be empathic about it with you as a woman. So thank you so much for sharing with us. And to our very wonderful audience, always coming out to listen, to learn, to cheer our speakers up as well, because if there are no you there listening to us, I'm not sure that W will be here every month. Thank you for always showing up. And I hope that all of these things that we learn every month, we actually, share it. The videos are also there for you to go back and listen again if there is any need, to get clarification. Oh, did I hear that part well? And of course, you have access, to our speakers as well through their social media handles. You can reach out to them, seek clarification where need be, and all of us are all the better for it. I want to leave us with this very important popular saying that health is wealth. And so please, we are pursuing money, we are doing so many things. Health is wealth. By the time the health is challenged, the wealth is obviously gone. So please take good care of yourself as a woman, and let's stop saying, God forbid, let's take action where need be. Let's go to the hospital. Let's visit Dr. Moji where need be. And then the wealth then can stay and we would enjoy it. So thank you so much and have a very, very wonderful rest of your evening. Thank you, Joy. Over to you.
Thank you so much, Ma, for that closing remarks. And thank you to our audience once again and participants for sticking by. I would like to say that before you leave this session, make sure that you have given us your feedback. The link is still being dropped in the chat room, and make sure that you have followed the W community. I'd like to say thank you to the W Initiative of Access Bank for this awesome platform. And till I come back to your screens again, my name is Joy Otto, and do have a pleasant evening. Bye for now.
Thank you very much for having us.
Dr. Moji, so it's wonderful to meet you. That was I learned so much this evening. I was writing.
Bye.
I see a light inside of you.
Oh, we can't speak.
So let it shine. It's time to spread your wings and fly. Reach for the sky. Get up, don't let nothing hold you. Get up right now, right now. Get up, don't let nobody tell you that you can't. There is greatness inside of you. You're the one that the world is waiting for. Every step you take, we go again. 'Cause we believe in you. Say one day you go make a push you down. Stand with the ground. Yes, we believe in you. Yeah. Don't you give up on yourself till the world knows who you are. Keep on shining. Get up, don't let nothing hold you. Get up right now, right now. Get up, don't let nobody tell you that you can't. There is greatness inside of you. You're the one that the world is waiting for. Every step you take, we go there, 'cause we believe in you. Say one day you go make a one day. One day you'll be like the sun. Say one day you go shine.
Access, more than banking.
It is such a great time to be a member of the W community because we are on a mission to impact the lives of thousands of women health-wise. Get ready for an experience like no other this October as W presents our Health Month. In this year's edition, W will be featuring a health webinar, physical health sessions in branches, cervical cancer screenings, pap smear, free breast examinations, free hepatitis B screening for you if you decide to take advantage of the opportunity. Healthpedia magazine to enlighten you on more information about your health and so much more as the month unfolds. Your W debit card is an advantage for you this season. Enjoy our discounted offerings when you transact with your W debit card. Click the link in our bio now to enjoy all our offers this health month. Ladies, this is not the time to take the back seat. You need a healthy body to achieve all of your dreams. My name is Ifeoluwa. This is W. Inspiring, connecting, empowering.
It's such a great time to be alive and a great time to be a woman. We are live here at Eco Hotels and Suite to celebrate Access Bank's International Women's Day 2023.
Equality is desirable. We've gone through recognizing women and then women are equal. Now equity, and equity cuts across every area of life.
I mean, we're here to stay, they have to accept us, and then we also have to keep proving ourselves.
And if we do more for women, we will enhance the progress, not just of the bank, but of the society.
Because if you're always in dissonance with one another, if you don't cooperate with one another, if you don't value one another, that shows weakness.
You know, I believe is embracing equity. It becomes, so when you embrace something, you own it, you take it as you put it close to you, beyond it just being an idea.
As much as you are a man, the woman is equal to you.
For the men that were here today to support the conference, I say thank you. And really, you are the real MVPs.
I'm tired of trying. I need help. I want to try IVF. I know it's expensive.
Are you struggling with a health challenge? Do you need financial help to access treatment? If yes,
apply now for MHSS, the Maternal Health Service Support, a discounted loan by the W initiative of Access Bank with low interest rates, no loan fees, flexible repayment plan. This is your best bet for financing your health needs. For more information, visit our website on www.thewcommunity.com or any Access Bank branch nationwide. You can also send an email to wcares@accessbankplc.com. Terms and conditions apply. The MHSS has successfully financed hundreds of health procedures.
the next one could be yours.